Hello everybody, it's me, Dr. Sandra Lee, aka Dr. Pimple Popper. I am a board certified dermatologist in private practice in Southern California, and you may know me more for my pimple popping these days. So I did a video called Go to Bed With Me, and today we're gonna react to the comments from the video. And a little bit later, I'm gonna answer some of your questions that you guys have about acne. Here we go. Okay, Margarita says her so cleansing wipes. Me screams in pain, in parentheses. Okay, cleansing wipes. I know there's a lot of debate and there's a lot of sort of controversy on the internet about cleansing wipes. There are a lot of people that are strongly against them. I use cleansing wipes, and I do know a lot of dermatologists, a lot of professionals use cleansing wipes, and I think that they're fine to use. I don't use them on a daily basis. I think that they can be rough on your skin. I definitely sort of pat my skin with them, and I don't use them solely to clean my face. They're sort of used if I have heavy makeup on, if I'm on the run, if I'm traveling, and I really want to get some makeup off and clean my face, but I don't have a sink in front of me and I can't completely wash my face. People complain too that or they say that it could be really bad for our environment. And I know that we're all doing the best we can to save the environment. And so I understand that. So if you're against cleansing wipes, don't use them. I mean, if you feel better about not wasting something, I completely understand that. But I do think that there's a place for them in our routine because they do make life a little easier for us. Okay, so here's the next question. Lisa Rose says, I thought micro tears were a myth. Well, anything can cause tears in your skin. I mean, even if you rub your rough finger on your skin, it can cause micro tears. And I mean, that's what our skin is designed for. Our skin is there to help protect what's underneath, and it's there to handle any tears or any disruptions in your skin. I mean, even the sun, when it hits your face, it's gonna cause damage. Everything does. Pollutants in the atmosphere, all of this. So I think as we get older, we are certainly more careful about things that really rub hard on our face, and not even so much that our skin gets less resilient to things, but more so that we're so conscious of it because we are more conscious of maybe like fine lines and wrinkles on our skin, and we're trying to keep our skin young for as long as we can. So I'm less rough on my skin as I get older, and I think that that is probably the truth for many people. But you know, micro tears it's a daily occurrence for us for many reasons. People should listen to these professionals only. Don't listen to YouTubers who just promote products/brands. You just really have to be careful on the internet. I find this more and more lately, actually, and I think it's going to become a problem, that people say things and it's sort of like it kind of snowballs, and then it becomes so spoken about so often that it becomes like this truth that everybody believes in. Recently, I talked about, I think even in this Go to Bed series, I talked about using CeraVe or Cetaphil cleansers, and some people get a little angry about that, and they say that there are carcinogens or there are cancer-causing agents in there. And I will tell you, I don't know a single board-certified dermatologist that would say, don't use these products because they can cause cancer. I mean, and that should tell you something, I think. We went to medical school, we did a residency for 3 years, some of us did a fellowship. I got out of school when I was 32 years old. I mean, we had specific training in all conditions of the skin, the hair, and the nails. So I think the bottom line is that you should do your own research and trust your own research, really, and really consult with experts in your area. A great board-certified dermatologist would be a great start. Lemon Sorbet says, since she applies deodorant at night, did she insinuate she doesn't apply it in the morning? This is the simplest, most affordable routine as of yet, apart from the syringe. I do apply deodorant in the morning too. I apply deodorant in the night, and I think I explained it in the video because our sweat glands are not as active at night. They're more dormant. They're sleeping like along with us. So it's kind of better to apply deodorant at night. It kind of helps to make it more effective. But I definitely apply it in the morning. I definitely apply it more when I'm sweating more, you know, during certain times of the year. But I also do Botox in the summer to my armpits. Not everybody may be able to do that. I'm not telling people that they should do that, but that actually does work amazingly well to help with sweat control in the area. All right, next. David Fletcher, it's amazing watching all these celebrities, YouTube stars with their uber complicated, expensive skincare routines. Then most dermatologists have basic routines with basic products from the drugstores. Yes, this is true, and I do see this, and I notice this in the comments, and I notice this in a lot of videos. You don't have to spend a lot of money to take care of your skin. I understand what it's like to use a really expensive cream. It smells good, it feels good. It makes you feel more luxurious, but if you don't have the money to afford it, it is not going to give you better skin than using a more inexpensive drugstore variety cleanser or moisturizer. I mean, I love Aquaphor. I love just plain Vaseline to put in places that are really dry. I love CeraVe. I love Cetaphil. I love Neutrogena, all the products that are they're like dermatology recommended. So, don't discount the inexpensive brands out there. SK says, I love her. I love you too, SK. And great tip before your wedding or special event, go to a derm and get the Deepzit Injection for cortisone. That's true. Cat in Wonderland says, love, love, love when my dermatologist injects my pimples. Yes, that's a special kind of trick, that we have as dermatologists. In fact, I carry that in my travel kit. Anywhere I go, I have a little injection ready to inject a pimple that I might have, or even maybe a friend might have with me. It's great because cortisone, a low potency cortisone injected directly into a pimple will actually stop its progression and potentially resolve it within 24 hours. What I'm injecting is a low potency corticosteroid. So a steroid like this, like prednisone or Kenalog, are actually can be injected for multiple reasons. But what we do is we dilute this steroid to a really, really low potency to inject directly into a pimple, so it does not spread systemically, it doesn't affect the rest of your body, it just locally calms that pimple down. What they essentially do is they blunt your immune system. Your immune system is so revved up, it's attacking this pimple, this bacteria there, making it really red and painful and swollen. We are injecting something directly into it to settle it down, saying chill out, just calm down, and that's what it does. Okay. Ryan Sim says, watching this is like getting a free consultation advice from a dermatologist without actually, having to pay for the session. I think that's what it was meant to be. I mean, that's what I was trying to do, and that's what we try to do. That's what I try to do in all of my videos, really, and on, my TV show, is really just try to give you advice honestly from my perspective as a board-certified dermatologist, and I think that's what we all try to do. Really, the point of it is really making sure that people feel good in their own skin. Sometimes when you get down this rabbit hole of watching all these skincare advice, videos from various people, it can make you feel bad about yourself and your own skin. You compare yourself. Just know that there are really simple things that you can do and to really feel proud in whatever skin that you have and feel good in the skin that you're in. It's Echo says, one thing I regret too is rubbing my eyes. It would feel so good. Now I feel like I have dark circles from doing that. Yes, I think I talked about that a little bit, how maybe I have a little bit of darkness around my eyes, and rubbing your eyes, like if you have a little allergy and you rub your eyes every now and then, that actually contributes to darkening around your eyes and dark circles, especially those of us who have a little darker complexion. We're more prone to that. So if you find that you have dark circles under your eyes or around your eyes, and you tend to rub your eyes a little bit, you might want to really focus on taking an anti-allergy medication to try to nip this, your allergy kind of issues in the bud, so that you won't have this tendency to rub your eyes, or really try to focus on keeping your hands off of it, because the more you rub, the more the skin gets a little rough or thickened and looks older, and the more the area can darken. Okay, next, Carrie Fulton. Any ideas on how to prevent milia on the eyelids and eye area? I have heard that eyeshadow with fragrance can aggravate this condition. I don't know about eyeshadow with fragrance specifically, but I think that just products that occlude your skin there more so can promote milia formation. But the skin there is very thin. It's the thinnest skin on our body, so it is probably more prone to being occluded or blocked than other areas of our body. So that's why that is an area that is more prone to milia development. So milia are those white pearly bumps that you get predominantly around your eyes. You'll kind of feel them, and they'll feel your fingernail will rub over them. They're under the skin, so it's not like a pimple that you can really squeeze them out, but they're usually like, they look kind of like a pimple, like just like a white bump. We as dermatologists, we can remove them in the office if we nick the skin and kind of use a comedone extractor and push them out. It's like a little pearl, we call them, because they look like a little perfect circle. They're actually just really superficial, tiny cysts. So they have a tiny little thin sac around them, and that's what makes them sometimes difficult to push out. I just had a milia right on my upper eyelid here a couple of weeks ago, and it was hard to take out, especially when you're trying to do it yourself. I should probably videotape myself doing that one time. People will probably be like, ah, because I'm a big wuss. So I cannot, it's really hard for me to just nick my skin. I have to inject it first. Injecting is so much more comfortable. Then you can go ham on something, I say, but that's not what I want you to do. I'm not really going ham. My version of ham. Actually, my husband's a dermatologist, and he's wonderful. He's a great dermatologist. He's wonderful, but he's also my husband. Every time he does something to me, he's like, I'm never doing it again, because you tell me what to do, and you can't tell me what to do. And I'm like, because you're not doing my way. My way is the best way. Rebecca Yep says, why Dr. Lee doesn't put on a moisturizer after the hyaluronic acid serum? She does the face. Just using the a.k.a. serum can't keep the moisture. Actually, hyaluronic acid is hydrophilic, meaning it draws in water. So a.k.a. is really great to keep the moisture on your skin. It is a moisturizer. I actually do double up though. I use multiple moisturizers because I am very dry, and I just think it depends on the person and your skin type. I think in this video I used my own a.k.a. serum, which is my brand, SLMD Skincare, and it also has squalene in it, which actually helps to retain the moisture in your skin as well. So it's more of a super moisturizing serum. I think that the things that I want people to understand is you don't have to spend a lot of money, and you should pay attention to your own skin type. If you feel like you're more dry despite using a product, maybe you need to add more moisturizer. If it feels like it's too oily, maybe you want to back off. And these are all things that I think are key. You need to listen to your own skin. Well, that was really fun, and I didn't have to take off my makeup, so that was all good. Now let's move on to some acne questions. Lady Liza says, how does someone treat acne when they have dry skin? I feel like all acne treatments on the market are targeted to people with oilier skin types. Yes, that is true, and it makes sense if you think about it, because usually people with oilier skin are more prone to acne, because that oil, that sebum that we create on our skin is one of the participants in acne. It acts in clogging up the pore, that causes a blackhead and whitehead. It's clogged with oil and debris and dead skin cells. But people with dry skin can also get acne. It is a little bit harder to treat because a lot of acne medications are specifically targeted to decrease the oil production on your body. The key part to this is really knowing what products dry out your skin more. Benzoyl peroxide dries out your skin more. I would concentrate more probably on like a glycolic acid or salicylic acid, because those are exfoliants. They get rid of the dry, dead skin layer, but they're not going to necessarily dry out your healthy, alive skin cells. Retin A can be really drying, but it is important for blackheads and whiteheads, and usually people really kind of adjust to it. So if you're getting a prescription, I would recommend a weaker prescription of tretinoin, and certainly there's retinol that's over the counter, which is great and is less drying than the prescription variety, but really easing into it is key. And that's what we tell our patients too when they're using a prescription tretinoin. And don't be afraid to use moisturizer. If you are dry and you have acne prone skin, use your acne products, but follow them up with moisturizer. That will help to kind of balance out the dryness. What are the different types of acne scarring? Okay, sometimes people say something is acne scarring when it is not, in my mind as a dermatologist, really scarring. And that's when you have red spots or brown spots after you have acne. People call it scarring, but I actually love to correct them because to me, scarring is permanent. And when you have red spots or brown spots after your acne, for the most part, those should usually resolve. And so red spots we call post-inflammatory erythema, PIE, and brown spots we call post-inflammatory hyperpigmentation. These are when you've had an area of inflammation in your body, and if you have a redder complexion, you get red spots. If you have a darker complexion, you get brown spots. So those resolve. Now, sometimes you have that, but then you have a true acne scar that remains. So there's different types of acne scarring that you may see. There are ice pick scarring, there is boxcar scarring, there are rolling scars. There's different types of scars that we identify or name because of the way that they look. And that helps us to categorize them into different treatment options. But really the whole key point for this is that if you have severe acne that you're not treating, you really should try to treat it because you don't want to end up with a scar like this, because that would just makes it really difficult to treat. Once you have a scar, it's much harder to fix it than to try to prevent it in the first place. Okay, and the next one, I'm 31 with oily skin and have had my nose full of blackheads literally every single pore since puberty. If I extract them, they're back in 2 days. Am I gonna deal with them forever? Is there a way to keep my pores clean? I currently use salicylic acid 2% and niacinamide serum daily. Well, you probably have some blackheads, but also some sebaceous filaments, which are interesting. You can go down a little rabbit hole if you Google that on the internet. They're sort of like, you have pores on your nose, and we can see them because you're looking directly at them, as opposed to at an angle on other parts of your face. Sometimes if your pores do get clogged a little and the dirt and the debris inside them oxidize, they turn a little black, and that's why you might notice them more. So yeah, using a good glycolic acid, a good salicylic acid. Actually, I have a new product. It's called Resurfacing Acne Swipes, and it has glycolic acid in it and salicylic acid in it, which are two great chemical peel ingredients for your acne. You can swipe them across your nose, and those, especially salicylic acid, will settle down within your pores and help to keep the pores clear of debris. But they're both exfoliators, so they help to minimize the collection in there, and that's what you're seeing, the black oxidization of the debris that's stuck within your pores. Is it okay to do a peel-off clay mask with active pimples? It's okay to do one. I mean, I think that if your skin is sensitive and you're actually peeling your skin off with it, I would say back off. Sometimes like retinol or tretinoin can make your skin more sensitive, and you have to be careful if you wax or do any kind of really strong peel. Obviously those videos that you see where people are screaming in pain while they're pulling it off, I think they're also pulling off their baby hairs, and that's part of the reason why they're waxing their skin at the same time. But if you're really pulling so hard that it's painful, I don't think that's a great idea. I mean, I think you can get the same kind of result with glycolic acid, with salicylic acid. They're gonna help to clean out the debris within your pores without having to be so aggressive and so just like brutal with it. Next question, is it okay to pop whiteheads? It is so satisfying, I can't resist. So I'm gonna say no, it's not okay technically, because as a board certified dermatologist, I can't tell people, I shouldn't, it's not right for me to tell people to pop their own pimples or their own blackheads or whiteheads, but I know that a lot of you are going to do it anyways, so I feel like it's my responsibility to really tell you how to do it in the safest way possible. It is the best or ideal circumstances to be able to pop something when something's a whitehead or what we call a pustule. When you have that pimple that comes up and then suddenly it comes up white at the end and you're like, I can't go anywhere with this thing on me. I mean, everyone's gonna look right at it. I mean, they're very easy to notice on your face. That is actually the ideal moment for a pimple to be popped, because you have to imagine that is actually white blood cells, that's neutrophils, that's your body trying to extrude this pimple. So you're sort of helping its release. by taking a nice, really clean, sterile needle. Make sure your fingers are clean too. Any instrument that you use is clean, like a comedone extractor. And if you just superficially nick it, you want to squeeze all that purulence or that pus out. And that's going to help to keep it clear and probably resolve a little more quickly, as long as there's not still pus underneath there. But the trick is really not squeezing too much and really making sure it's really superficial, because the more superficial you traumatize your skin, the less chance you have of causing any really permanent damage. Okay, is the acne face mapping a thing? I mean, is it true that certain areas of your face are connected to problems with other organs, etc.? Not true. I think that there are some truths to it mildly, where I know that as a dermatologist, if somebody comes in with like acne more in what we call the beard distribution, along the jawline, along the neck, I am more suspicious of hormones, specifically testosterone, that can cause acne breakouts. Sometimes that actually clues me in that somebody might have PCOS or polycystic ovarian syndrome, because they tend to secrete cysts on their ovaries that secrete testosterone, and testosterone can really make us break out as females, but more in this distribution. But it's actually going to be associated with more hair growth in this area. Imagine things that testosterone can trigger. Hair growth and maybe even a little deeper voice. So those are all sort of things I pay attention to if somebody comes in specifically with an issue in that area. But other than that, I mean, you're getting breakouts in your forehead, on your nose, and your chin because you have oily skin, you have hormones that are making you prone to it. If you have breakouts like along one side of your head where you put your hair, and you have product in your hair, that's probably because of what's called pomade acne. So there's a lot of reasons for it, but acne breakouts in your face don't reflect some internal problem going on. Okay, that's it. I hope I answered a lot of your questions. This is again Dr. Sandra Lee, aka Dr. Pimple Popper, and this is Derm Reacts. Subscribe to see a lot more videos like this, and give this video a big thumbs up. Drop your questions, concerns, and debates in the comments below, and maybe we'll select your question for the next one. Oh, and don't forget to follow me on YouTube and on social media, Dr. Sandra Lee, aka Dr. Pimple Popper, and check out my skincare line at slmdskincare.com.